We're going to keep on every Tuesday for about 60 minutes until we wind down later in the summer. We're going to ultimately transition to in-person programs, but for now we're virtual. So John, welcome. Take us away, get our hearts moving, and then we'll hear from Dr. Seth Gale. Thank you.
Hey. Welcome to the Emory Alzheimer Disease Research Center. Today, remember, go at your own pace. But I'm gonna slow it down today because a lot of people been asking me, what can we do for those abs and body scope in the chair? But we never gonna leave without that cardio. So if you have any water bottles, canned goods, or you can just use your arms for the day, but I'm gonna show you some simple exercises you can do. Here we go. I'm gonna use my canned goods for my chest. The center part, just lean back and press. Turn this down. And good. Now, for the upper chest, to get you a little lift, it's called incline. So I'm gonna be at an angle, and I'm gonna go up at an angle. And good. Some people want to work on the pectoral, your outer lats and the rear delts. It's like the pec machine that you have in the gym. You want to go in and out. You ready? Let's go. 1, 2, 3, 4, and 5. Good. If you want to work on those shoulders, those lats and rear delts, open up a little bit, and we're going to go over like an overhead hug. Let's go. 5. Good. If you want to really work on that lower back, that upper back, like a big hug, head straight and over. And squeeze, 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 squeeze one more, and squeeze. For those biceps, put your elbows in front, and you want to go here, not back here, in front, and curl. And squeeze the bicep. 1, 2, 3, 4, and 5. Now, everyone asked me about the triceps. Elbow up, and just let the elbow, but don't move nothing else, and press. 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 And press. Let's get the other arm. Elbow up, and press, 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 and press. Good. That's just some simple exercises you can do. Now for the abs. What I'm going to do is I'm going to lean back, and let's just do right leg. Hold on to the chair. Boom. Now we're getting the lower abs, the mid abs, because our leg is the weight. And good. Other leg. 5. Good. Now, our next one, to really get the side obliques lower, open up. This leg is straight and up. Keep your body square. There we go. 5. Good. Let's switch. Angle. Keep your body square. Hold on and up. Good. Now, both legs, now we're really gonna engage. Boom. Remember, those your legs, pull those abs. And 5. Really engage both legs out of the angle. Lay back and let's go. 1, 2, 3, and 5. Good. If you want to get more engaged in the side obliques plus the total core, we're going to go left to right. 1, 2, and 6. Now, if you want to take it to the next level, use a straight leg and lean back and go straight up. And good. go. 1, 2, 3, 4, and 5. Let's do both legs, but we're gonna go up and then wide. Let's double it up. Last one, let's go. Up, wide, straight, wide, straight, wide. 2 more. Up, up, and good. Great job. Some simple exercises you can do for that core and that upper body. But let's get that core in and finish up. Here we go. Let's get it. Because we're going to work on the entire body, plus we're going to get more cardio in and not leave out those abs. I'm John Lewis, and see you later. Bye.
Thank you, John. Yes, absolutely wonderful. He does a little different stuff every week with us, but he's giving you just a teaser of what you can do at home to stay active, moving, engaged. And what do we refer to that as? Being neuroprotective. All right, welcome everyone. I'm going to turn it over to Dr. Monica Parker. She's going to introduce Dr. Seth Gale and tell you who else you will be hearing from today. Welcome, Dr. Parker.
Good afternoon, everybody, and thank you so much for joining us today. This afternoon, we are really being given a treat. Dr. Seth Gale from Boston and Harvard University will be here to talk to us about healthy aging, of course, but also about research that's going on that we're doing here, as well as what they're doing in Boston, and that's our AHEAD program. So at this time, I'd like to introduce you to Dr. Seth Gale, who directs the Alzheimer's Disease Research, the AHEAD Study and Research Center there at Brigham and Women's Hospital. Thank you.
Thanks, Dr. Parker. I really appreciate the invitation for being here. I'm happy to present this information, and the plan is for me to. This is a big topic, brain health. So I want to make sure that people can hear me. Can I get a thumbs up if people can? Okay, good. This is a big topic, and for a short period of time, but what I'll try to do is present information on brain health, on some of the work that we're doing, as Dr. Parker mentioned, at Brigham and Women's in Boston, Mass, and then hopefully some time for questions at the end. So let me share my screen. I have some slides to go through. So I'm going to talk about this topic, maximizing brain healthy behavior and to decrease the risk of cognitive decline. So 4 kind of sections. So first, just background. So I want to review normal cognitive aging versus dementia, and how we think about the spectrum between aging and cognitive impairment, and then dementia. I'm going to talk about the Brain Health Champion study, which is one of our studies that is at Brigham and Women's Hospital, where we're using health coaches to try to help people change behavior to decrease cognitive decline risk. And then some very basics about what we can do right now for brain healthy behaviors, which it sounds like a topic that has been presented in this forum before. And I'll just go over 2 main points from the research in that area. And then, as Dr. Parker said, we'll talk a little bit about the AHEAD study, which is a national study. Actually, it's a global study, actually, which is a prevention study. So people who don't have memory impairment, but have risk factors for Alzheimer's disease, and who are identified by having a PET scan done, an imaging study of the brain that identifies the plaques in the brain. That is the ultimate change that you see with Alzheimer's disease. So this is how we'll go through. So let's start at the beginning to get a little background. So I want everyone to imagine this long spectrum of aging that you can see in this graph here. So you can see that when we get older, this purple line, this purple dotted line represents what happens with the brain and aging over time. So with normal cognitive aging, when there is not any sense of memory loss, that trajectory still declines over time. So as we get older, and we all know this, we have less sharpness of memory and processing speed and other things, mental functions that slow over time. And then you can see this curve. Again, age is here on the x-axis. So as you get older here, the curve goes this way. And memory and cognitive function is here on this y-axis, this vertical axis here. So in this curve, you can see that people start off as normal aging, and then there are these three main categories that we call preclinical or subjective cognitive decline. I loop those together here. This is people who do not have symptoms yet. In the case of, they don't have memory decline when you do testing for them, when you ask them questions, but they still have they still have a risk of declining. And then there's this category that people may have heard of called mild cognitive impairment, which means that compared to the same age, so you compare yourself to someone who's your age, you have more memory decline, more memory problems than people with normal aging. And then there's this term dementia, which implies that people who have enough memory difficulty that it's impacting some aspects of daily functioning. So this is all mentioned in this text here, but I want people to remember this as we go through, that the idea of interventions like brain health, guidelines, exercise, following a Mediterranean diet, staying socially and cognitively active, the idea is to keep people on this curve as close as possible to normal aging. And especially for people who have risk of higher risk of Alzheimer's disease and other dementias, we want to be especially aggressive with either with medications, which we'll talk about, or with lifestyle behaviors to try to keep them on this top of this curve. Okay. So this slide talks about this term mild cognitive impairment. Again, the in-between stage, right, between subjective cognitive complaints, or basically being close to normal aging problems, and dementia. Okay, and then dementia. So dementia just simply means that someone's thinking and memory difficulties are impaired enough to cause a change of daily functioning abilities. And that could be things like doing the bills, cooking, driving, other, using household appliances, things that person was able to do in recent past but can't anymore. And so there's evidence that 15% of people over the age of 71 are in this dementia category. So this is a large population of people. And just another note is that from the transition from mild cognitive impairment, which is this in-between stage, to dementia, is somewhere between 5 to 15% per year for any one person. So what that means is that if you follow every year someone who has this intermediate stage of memory difficulty, they have every year their chance increases of having dementia. So this is an important place to intervene because the risk increases over time. So normal cognitive aging, senior moments. So some of these experiences, include like forgetting why you walked into a room. We've all had that experience. word finding difficulties in conversation, making the wrong turns while walking or driving, misplacing items around the house, right? These are experiences that we all have, and we have more so when we get older. We know that. And the question is to sort of pay attention to these things to differentiate them from beginnings of Alzheimer's disease, right? And you don't have to do that alone. That's done with family members, with friends, with input from medical providers, right? To go over these symptoms, right? And, you know, this is nothing that anyone doesn't know, but you can evaluate someone by understanding what's going on with them, by taking a history of what's happening, and do basic memory testing and other basic tests to try to identify the differences between normal cognitive aging and early signs of dementia or Alzheimer's. And I put this in to just give a couple of other examples of this, where it's really a spectrum, right, between having some day-to-day memory difficulties, right, and there being a cause for concern all the way here in the pink to the left, and then there not being a concern all the way here to the blue on the right. And, you know, some people fall in between, or closer to the right or closer to the left. So some examples are for people who forget a lot of recently learned information. You know, the content of conversations that you have from one conversation, from, you know, 1 hour to the next, for example. That's more concerning and cause for seeing a doctor or bringing it up to medical attention in some way. Whereas, you know, forgetting things like names or appointments occasionally or even somewhat frequently, but then that information coming back to you, right? That's likely harmless, you know, still could be brought up to attention, but is likely in this harmless category. Okay, so these are, another example is temporarily misplacing your keys or your wallet, but then recalling where they are and finding them. We've all had experiences like that. But then if that's happening consistently, and someone is misplacing items or putting them in unusual places, you know, more consistently, that's cause for concern. So anyway, this is a helpful graph. This is from the Alzheimer's Association, actually. So that's a little bit about those differences. So with that background, let me tell you a little bit about the Brain Health Champion study that we've been doing at Brigham and Women's. But first, just to before we get to the actual study, just to talk about modifiable risk factors. So we know that there are many risk factors for having Alzheimer's disease and related dementias. And we also know that some of them are modifiable, like meaning that you can make changes, and that's what all of the brain health education we do is. And some of them are not, like your genetics, for example. And so what this is describing is that you can reduce, as a society, as a population, we can reduce the rates of Alzheimer's and dementia by the millions, basically, if we can get people overall to lead healthier lives. So this is not trivial. This is a major public health type of initiative, right? To try to help people maintain healthy lives in order to reduce dementia risk. And what this study demonstrates, which is interesting, is that physical inactivity, smoking, and depression, for example, were some of the biggest risk factors and contributors to getting dementia. And so those are things that are all modifiable, meaning one can address them. Okay, and then I really like this chart because it includes a lot of things we talk about in one visual. So this is describing modifiable risk factors. So on the top, these are all things that over a lifetime increase risk of later life cognitive impairment and dementia. So things like hitting your head, traumatic brain injury, concussion, midlife obesity, hypertension, high blood pressure, depression, smoking, poor suboptimal sleep, etc. And so again, it's not one or the other. The brain is kind of like a vessel in which we're doing everything we can over a lifetime to build its resilience and reserve. And these are all things that we can do something about over time to reduce the risk. Okay, and then similarly, these are things that you can do on the bottom in green that you can do actively to decrease risk. So ongoing education and cognitive stimulation, so keeping the brain active at any age, can increase cognitive reserve and resilience. Physical activity, following a healthy, brain-healthy diet like the Mediterranean diet. Formal cognitive training. People may be familiar with online cognitive training where people are following a guide or in a small group to do brain activities to kind of keep the brain active, like puzzles or different kind of skills to record memories better when you hear them. Okay, and then social engagement here as well is listed. Okay, so with this in mind, what we've been doing is trying to really intervene on and impact people's behavior change. So it's one thing to say, which we all agree, and we all know that there are a lot of different modifiable risk factors. All of the major health organizations and medical professional organizations agree that they say we need to exercise, we need to stimulate the brain and mind with puzzles, with activities, we need to stay socially engaged, etc. But the challenge has been to actually do that, especially in a health center, like in a medical center, right? So you see your primary care doctor, you might see a neurologist like myself, they advise you, oh, this is the things that you need to do. And we see this all the time with our patients where we, in everyone's best interest or in everyone's best intentions, I mean to say, we're trying to help people change behavior, and patients and people want to do that as well. And they say, we're going to change our behavior. And then we just found over time that it was not happening, that we would see people every 6 months who have mild memory difficulties, advise on what to do, even with specifics, and then have people come back and say, oh, well, there's a lot going on, which is understandable. And I've only been able to do these things and not these. So we tried to figure out a way, a program to really, in a real world way, to help people adopt and maintain these brain health behaviors. So the first iteration of this, what we call the Brain Health Champion Study, involved 40 patients in our clinic, in our neurology clinic, who had either mild dementia, so they had just some loss of independence in some basic higher level activities, like whether it be driving or doing the bills, but were able to generally function well. And then there were 15 patients in that category. There were 21 patients in that mild cognitive impairment category I mentioned, which is in between normal aging and having actual interference with daily functioning. Okay, so these are people with just memory and thinking difficulties, but not interfering yet with daily functioning. And then there were 4 people who had just complaints of memory difficulty, but when we tested them, their memory was normal. Their testing was totally normal, but they felt that something was off, something was wrong. Okay, and we split those people into 2 groups. So one group had a health coach who was a post-college student who we trained in giving them brain health knowledge and also some basic health psychology techniques working with a psychologist. And the other group, so that was one group, the health coaching group. And then there was a usual care group, which was just the group of, just the typical interactions that person has with their doctor. So like, let's say I would see a patient now and then 6 months later, and we just kept people in that group. And I advised them, or whichever doctor in our group advised them the same way that they were before on what to do for their brain health, but there wasn't an additional team member. And so in the health coaching arm, so half of those 40 people, they worked every week with a simple phone call, which was 15 to 30 minutes with a coach. That was one of these coaches, one of these individuals I mentioned who we trained to follow this brain health curriculum. And then they had in-person visits every 6 weeks where they met with this coach in person. This study was actually just before COVID. And then there was a counseling session with a dietitian at 6 weeks. So weekly phone calls, one in-person visit with a dietitian, and then an in-person visit with the coach every 6 weeks, over 6 months. It was a 6-month study, okay? And what did we look at? We looked at basic questionnaires in asking people about what physical activity are they doing at the beginning and at the end. What's their dietary pattern? They had to log their food intake and their diet. And what's their cognitive and social activities engagement. So there's a questionnaire that involves recording what you've done every day. Did you read at all? Did you play card games? Did you watch a television program that made you, think about things? Did you do a puzzle? All that kind of stuff. And then we also looked at in this group of people, their quality of life scores, which are real valid measures of people's report of their quality of life. We looked at their levels of depression and anxiety, and we looked at the quality of their sleep and their social network size. So how many people they interact with on a regular basis. And this is just a flavor of the curriculum that the coaches followed in the health coaching arm. That's the active arm of the study. And so the focus was on those four main activities that go from left to right. So physical activity, examples like encouraging walking, cycling, lifting, objects or weights, various different things, whatever. This program is very personalized to the patient, to the participant. And then there's diet, there's social activity, as we talked about, and then there's cognitive activities. And then these other components, like their current medications, aspects of overall health, stress management, and sleep were also part of the conversations and the interactions that the coaches had with participants over time. And there's a lot of evidence to show that these behaviors can reduce the risk of cognitive decline and dementia. There's a whole literature that supports that, as many of you probably know. And it's been shown that a set of behaviors themselves, not just one, so not just adhering to physical activity, but neglecting diet, or increasing your social activity, but neglecting physical activity, it's the set of behaviors that's more effective in reducing the rate of conversion. That is a change from people who have memory complaints to people who have actual memory impairment, and then people who have memory impairment that interferes with daily functioning, which is mild dementia. And so just to show the basic summary, so you can see, so the red line going from left to right and up in the air shows that is the group of people that were in the health coaching arm. And the blue line is the group of people that were in the standard of care, just the usual care, the people who just met with their doctor as normal every 6 months or so to see. So without knowing anything else about the actual raw numbers of the study, this was a huge success of this study. There was no chance of this being just a lucky finding, right? This was very significant that people in all of the outcomes that we looked at, diet, social activity, exercise, and then looking at all of them together, the people that had just a weekly phone call with someone outside of the health system, just a health coach, and then one meeting with a dietitian, had significant adoption of these brain healthy behaviors, right? So it was a really simple, low technology intervention. It's just a phone call that we made, okay? And then taking from there, we improved or thought about ways to engage people more, to improve the communication between coaches and participants, and to get some more information that was more quantitative, right? And as opposed to just people reporting, yes, I ate better, yes, I exercised more, relying more on trackers. People have probably heard of Fitbits and other fitness trackers where you can track your steps and that kind of thing. So in this next iteration of the Brain Health Champion study, we took 2 groups of people again, and these people were both people that had some memory impairment in the neurology clinic, but also from primary care clinics, from regular medicine, internal medicine clinic, people who were just cognitively normal, but had risk factors. So no actual memory impairment at all, just cognitively normal folks, meaning that their memory was normal for age. And we put all of those together, age 60 to 79. And this particular study is ongoing. We've enrolled about 45 people in this study so far. And we split those group of people, the cognitively normal folks and the memory impairment folks, again, into 2 groups with a health coach and usual care, just as they normally were being seen by doctors. And this time in the health coach arm, we added this app that is called Fruit Street Health, that is used for diabetes education and management by health coaches often. But we used the technology of it, the video and the text messaging that you can do between coach and participant, because we liked the platform, the actual app itself. So in this part, people had to have some access to some smartphone or an iPad or some device. And we allowed the coaches to communicate with people that way using this application. We also gave people fitness trackers to make sure that during this is also a 6-month study, but make sure at the start of the study and at the end, they were recording information. Actually, I'm looking at time and I want to make sure I have time to get to everything. So anyway, this study is ongoing, but what we've showed so far, and really importantly, is that people in this age group from 60 to 79 was the age group that we used, were really able, sometimes with a spouse, if they had some memory impairment, were really able to use this mobile health technology, which is huge because, if this program is the kind of thing that would be scaled to a larger level, to have a whole population of people do this, or to run a program like this through the local YMCAs, or to do this through community health centers or what have you, you want to make sure that people are using the mobile health technology and able to use it. So that's been really promising. And then so far, it seems that people in the health coaching arm, compared to the standard care, which is the usual counseling with their doctors, showed increase in cognitive activities and adhered better to the Mediterranean diet with this health coach intervention. And then overall, it seems like being involved with this study, whether or not you're in the usual care arm or the health coaching arm, people did much better on pre and post memory testing. So it meant something to be part of this program. People did also much better in their quality of life measurements, meaning they increased in quality of life compared to their own quality of life at baseline, and also active minutes. So a larger vision for a program like this is to do something like this, maybe with peers, where peers could be coaches. So there would be older individuals who go through a program like this and then are peer coaches for others to take them through to increase brain health. Or youth poor, like people that are just out of school or that are interested in helping middle-aged and older individuals adopt brain health behaviors, right? There's a lot of ways to increase a program like this. I'm going to skip.
Excuse me, Dr. Gale. You go on with what you're saying, but everybody is like, can we do that here? Can we do that here? Can you come here and do that? So if you're thinking about an exploration site, please consider us.
I really appreciate that. I'm happy to do ongoing, to talk more with you all. Absolutely. Absolutely. Thank you for bringing that up. So I'll just finish because we're running out of time here and I want to make time for questions. I put some information about the Mediterranean brain healthy diet. And I think Dr. Parker mentioned at the beginning, healthy heart, healthy brain, or maybe after John did his outstanding exercises, it was mentioned. But in any case, we know this is true from a lot of research. And I'll just end with the AHEAD study. So in addition to brain healthy behaviors, there are medications that may be and probably will be effective for people who are cognitively normal, so they have no memory difficulty. But when you do a scan of the brain early, let's say at age 55 or so, they have evidence of plaques in the brain. So they have some evidence of the early changes. People may have heard of plaques and tangles. Those are the two changes you see under the microscope with Alzheimer's disease. So there's a lot of promise that using a medication for those individuals can reduce the bad actors in the brain that are building up these plaques or other tangles in the brain, and decrease the amount of them, and therefore decrease the incidence of decline. So it's really like the way you would intervene for any condition before it's too late, before there's already memory loss. So people collect amyloid in the brain many years, maybe 15 to 20 years prior to actually having memory decline. So this is really important. So there's a study that's ongoing that is using a medication in almost 1,200 people. This is a global study, okay, called the A4 study. This study is ongoing and is due to finish at the end of this year, hopefully. And in this study, there's a medication that's being used for people who all entered the study with no memory difficulty, but who had an abnormal scan of the brain. So the PET scan of the brain was abnormal. Okay, and then I'll just leave us with this AHEAD study. So this is an ongoing study that Emory University is actually recruiting for, as we are at Brigham and Women's Hospital. So this is a study that's very similar design to the A4 study I just mentioned, where people who are age 55 to 80, if you're in the 55 to 64 age group, you have to have one additional risk factor for Alzheimer's disease, which is a family member diagnosed, a first-degree relative, either mom, dad, aunt, uncle, someone who's 1 degree away from you, who had a diagnosis of Alzheimer's or dementia prior to age 75. But in any case, the Emory site can talk more about that if you're interested, as we can as well, age 55 to 80. And this is a 4-year study. So let me just jump ahead. The AHEAD study is 2 studies within one, based on the level of amyloid or plaques that are detected on the PET scan. So you come in to the study, to the site, you take some memory questions, you get your medical history reviewed, and then you get a scan done of the brain. And if the scan shows those early changes of Alzheimer's disease very early, before symptoms, and it's an intermediate level, then you're in one arm of the study. And if it's a really elevated level, then you're in the other arm of the study. And those are called the A3 and the A45 study. Okay, and why do this? Well, the only way to answer questions about Alzheimer's disease and to see if we can intervene as early as possible is to understand what's happening and to observe people over time. And we have to do this together because this is a huge, huge problem. So this is from the AHEAD study itself. And the website, by the way, is called, if you want to look, it's called aheadstudy.org. And so this it was a little bit of the information that you can find there. But essentially, 6.5 million people, at least in the United States, have Alzheimer's disease. Communities of color are especially at risk. The rates are 1.5 to 2 times higher in the Black community compared to white counterparts for Alzheimer's disease. Topic of a whole nother conversation that's important. And then treatments are needed now really to help. And this is what I was trying to make the point of. So age 55 to 80, you have not been diagnosed with Alzheimer's disease or another memory or cognitive impairment, and you agree to being part of a 4-year study, which is not small, but worthwhile. And the visits can be anywhere from usually once a month once you get going in one arm of the study, and the other study it's about once every 2 weeks generally. All right, I'm sorry I didn't leave that much time for questions. Let me stop and answer anything that I can. Thank you for paying attention.
Thank you so much, Dr. Gale. And we do have questions in the chat, but I'm going to have Ms. Dorbin kind of funnel through some of them. I answered 1 or 2.
Okay, thank you, Dr. Parker. Okay, Dr. Gale, yes, no worries. We are just going to devote the next 10 minutes, if you're available, to Q&A. We will bring on Dr. Benhamer's talk next week, which dovetails very nicely with what you said, because she's addressing nutrition and brain health. So there's some specific questions, but people want to know, like, is this app accessible, or is there an app you would recommend for the age group if they cannot access your study?
So that's a good question. To be clear, so what we've done, right, so our study right now is at one site. It's a small study. It's at our site in Brigham and Women's. The app that we've used, it doesn't itself have content on it. It's just, it was used because you're able to use it in the health system. And so it was, we were allowed to use it as opposed to using something like FaceTime or something else. So in fact, it's not, you're not missing anything really with this app I'm describing, because the real meat of the program is in the interaction between the knowledge of the health coaches and the participant. As far as generally speaking, with apps, there are cognitive training apps. There's a lot out there. People might have heard of Lumosity, for example, and other cognitive training apps. They're from the medical world, the medical establishment. Generally speaking, all those behavior, keeping the brain active with doing online apps and activities is very good, but it's still a matter of research to recommend one or the other. So there's no one particular platform or app or anything that I can recommend, but I think it's anything that people do is related to keeping the brain active, whether it's puzzles, whether it's other kinds of mental stimulation, is extremely good for the brain. So I'm cautious to say go to this one or go to this one, because they really need to be studied more.
Right, and even if it's something mainstream on the market, we're very selective, because people may think we're endorsing or sort of co-signing on specific products. And, in the clinical space, we do try to steer clear of that. Now, and then a few more questions. Can you talk about just inflammation in general? Because we know how inflammation sort of begins that cascade of a downward spiral for some people, and just that correlation with brain health. Sure.
So, I mean, several of the brain health behaviors that we all know from these studies that reduce decline are getting at this idea of decreasing inflammation or inflammatory markers in the brain, including exercise, including diet, etc. And so we don't know exactly what causes the first changes in the brain, the collection of amyloid plaques or the breakdown of cells, but we know that people who have more inflammation prior to or around the same time or concurrent with or prior to the amyloid plaques have more of a risk of having more of a decline. So I think it's unclear to point to say this exactly leads to this, but people with higher degrees of inflammation, whether the body is like attacking itself with autoimmune kind of meaning like autoimmune conditions, meaning the body is attacking its own system, or with poor diets that are high in items that increase inflammation, like processed sugars and very saturated fats on meat, for example, those things lead to higher levels of inflammation. one other thing related to that is there's with like type 2 diabetes, for example, people may know that uncontrolled diabetes, of which there's a degree of inflammation, higher inflammation in the brain, is itself a risk factor for worse memory decline. So people with uncontrolled type 2 diabetes have more of a risk of memory impairment and decline. So I think it's an evolving story, but the question is right, that the idea of inflammation or inflammatory markers is related to memory decline and dementia in general.
Excellent. And so AHEAD is a global study. Our entire goal and mission is to enroll individuals in research. But if someone is interested, but possibly outside of, the geographic area for a study, are you all paying for transportation or allowing people to enroll even if they're not, let's say within 50-mile radius of the center?
Yeah, so that's a very good question. I think it's very specific to the site. What I would encourage people to do, so for example, with our site we have funding to support, transportation for people who, again, it has to be feasible enough that they're coming into the city of Boston, frequently, et cetera, but it's doable from, people who live hours away. So what I would encourage people to do is to look at the AHEAD study website. It's aheadstudy.org. There's a very nice map there that has all of the sites in the US. There's also sites, I don't know if it's on this map, but there's sites in Canada and there's sites in Japan and Australia and other places as well, actually. And contact the site. So I'm sure the folks that are on from Emory University can also provide information about, contact as well. But that's what I would do. That's what I would do. Yeah, I see it's in the chat. Perfect. Exactly. With a phone number and email. Yeah. Yeah.
And so you talked about the PET scan. Is that universally accessible? Can anyone get a PET scan if they're like, I think I have amyloid in my brain? I don't know. Break that down for our audience.
That's a great question. So it is approved by the FDA for use. So it can be done in any clinic in the US. However, it's not really like ready for prime time yet for use in clinical care. So we do it occasionally. It's not covered. It's not paid. It's not covered by insurers. Medicare does not cover it, for example. So in the AHEAD study, to be clear, it's covered, it's paid for because the AHEAD study is a research study. So one of the great benefits of being a participant or screening for the AHEAD study is that you have to be proactive about this and want to learn this information, but you will learn the result of your PET scan. So if you're someone who has or doesn't have a family history, like sometimes people are motivated by family history, sometimes people are motivated by their friends, they're by knowing that this is a problem in society in general. But if you're interested and you have those risk factors or that interest, you can come to the AHEAD study site, answer memory questions, get a PET scan done, and you will find out if you're eligible or not to proceed in the study. So that was a long answer, but I hope I answered it. It doesn't cost anything, but it's kind of still a research tool, but it will be moving into doctors' offices soon when things are figured out related to coverage and care.
Right, and Dr. Parker tells us you kind of get your best care as a research participant. It's not for us to entice you, but you're on the front lines as a participant. And one thing we say is well, it's not free. It's just we don't have to pass that cost on to you because it's your time, it's your energy. You are a volunteer and you're kind of helping us to navigate new discoveries, but you're getting some insider knowledge as a participant. So until there's a cure, research is our only hope. finally, I think we are wrapping up. I'm going to turn it over to Dr. Parker shortly before Matt comes on, but you talked about exercise and doing puzzles and reading. What are some other specific things outside of, the Mediterranean diet? Like, what's your list of top 5 things we would close with telling our viewers what they can do to protect their brain?
That is a good question. I think that social interactions, so think about your social network. So you have family, you have neighbors, you have community groups you're a part of. I think an underappreciated thing is increasing your social network, your social activities. So that could be a small thing. That could be like, there is a nephew who you really like, who you get along with, but you only talk with them once a year. So make that a monthly Sunday afternoon call where you have an hour of time or 30 minutes of time or 10 minutes of time where you're connecting with someone. So I think regularly scheduled social activities to increase your social network is really important. Let's see. I think experimenting, taking something like the Mediterranean diet, again, it doesn't mean that tomorrow you have to eat these 20 things and today you're eating these 5, but taking it slowly, understanding what that diet is all about, which is really fresh fruits and vegetables, lean sources of protein, fish, beans, turkey, right? This is not like that much of a stretch for many people's diets, but taking it slow, figuring out recipes and things that are easy to do, that you enjoy, that you like, that have, things like spices, sauces, things that are not that much of a stretch that you can add to. I think diet is really important, and it's something that you can build over time. Let's see. I'll come up with one other one that I think is important from the research. I think the last underappreciated aspect of all this is keeping up with one's overall health. So if you focus on diet, social activity, and exercise only, but you're not getting checked out with your vision, like an annual primary care checkup, or blood pressure is not controlled, or you're not having the colonoscopy that you're supposed to have every 10 years, the kind of regular medical stuff. It's really all of those things can contribute to bad brain health. So uncontrolled blood pressure, and high cholesterol and too much alcohol and this sort of thing can all be neglected as you maybe push forward and try to do all this brain health stuff. So I think that there's a lot of evidence that keeping up with one's overall health also does a lot to reduce the risk of decline. So I gave you 3, not 5. But
fair enough. All right. Well, again, before we close, and I'm going to turn it over to Dr. Parker, we just want to encourage you guys to grab that YouTube link. The recording will be posted within by the end of the week. You can watch it again. And we're just giving you guys a taste. This is like a 50,000 foot view. This talk could go on for 3 more hours, I promise. But we only have 60 minutes. And there's over 100 videos on our YouTube link where you can access all this great content from our Emory faculty and from our colleagues that are doing brain health research around the globe. All right, thank you, Dr. Gale. Welcome back, Dr. Parker.
Thank you again, Dr. Gale, for speaking with us this afternoon. You gave them a whole lot of information. They're asking and sending a whole lot of questions and messages to us on the backside of things.
Sure.
There were over 245 people who heard you today. So they're really kind of excited about all the things that you talked about. And we look really forward to hearing more about what you're doing in Boston, and certainly anything that we can do. In any event, at this time, thank you again, Dr. Gale, for your time and your attention. And we will be sharing this video. And for the audience, thank you for your attendance and your registration. And that's it for my comments. And I'll turn things over to Matt Doiron, who's going to introduce you to our cognitive empowerment program. That's right after this one. Thank you.
Thank you.
Hi, everyone. So in a few moments, we're going to be having our CEP Community Live webinar. So that is a different webinar where, but we have very similar content. Today, we're going to be joined by Megan Nair, a great yoga instructor. If you've never done yoga, I highly recommend it. She makes it really accessible for new people. And so if you'd like to kind of get a yoga workout coming in a few moments, I just posted the link to register for our event in chat, and hope to see you all there. We're going to be starting in 1 minute.
Thank you, Matt. And yes, we are having the research social on Monday at Executive Park. Crystal's going to drop in the registration link if you are interested in becoming a research participant. We want you on campus with us Monday, but you have to pre-register. Also, as Matt said, the CEP Community Live link, it's a different link than our BrainTalk Live link. So if you're not registered for the 3 p.m. call with CEP Live, you have to go in, grab that link, and register for that program. It's a separate link. But if you have already registered, you're good to go. You can log out and hop on over and join them for yoga, which is neuroprotective. Everything we do and everything we promote is to help improve your brain and ultimately get you involved in research, because we are a nationally accredited research site. All right, we will see you back here next week with BrainTalk Live. Thank you.